Well, good morning, and thank you for joining me today on the latest update on COVID-19. As of 7 a.m. this morning, 5,201 people are hospitalized due to COVID-19 in Pennsylvania. 1,062 of those patients are in the intensive care unit, and 640 of those patients are on a ventilator. The trend in the 14-day moving average of the number of hospitalized patients per day has increased by 5,100 since the end of September, and that number has recently decreased a bit. Today, we are reporting 5,338 new cases and 7,506 new cases from Sunday. This brings the total number of COVID-19 cases in Pennsylvania to 726,154. Of our total cases, the number of people who have recovered from COVID-19 is now at 74%, and this number has started to increase again recently. Tragically, 83 new deaths were reported today and 103 new deaths for Sunday, for a total of 17,853 individuals who have died due to COVID-19 in Pennsylvania. The statewide percent positivity, as reported on the early warning monitoring dashboard, is now at 14.4% statewide. This is still a slight decrease from last week. We have 14 counties with a county percent positivity rate above 20%, and pretty similar to last week where it was 21 counties. Now, in regards to vaccinations, statewide and nationally, we are seeing an increase in the number of vaccinations for COVID-19. Now, to date, Pennsylvania has received 827,300 doses of the 2 approved vaccines. And through our missions to vaccinate healthcare personnel and those living and working in skilled nursing facilities, we have administered 285,671 total vaccine administrations. This includes 243,089 first doses of one of the 2 vaccines, and it includes 21,291 healthcare workers who have received both their first and second dose, and now they are fully immunized. In addition, we know that over 48,000 residents and staff of skilled nursing facilities have been vaccinated. That number could actually be even a little higher, as we are waiting for CVS to complete the upload of its data into our system. Now, we know that nearly 138,000 doses have been allocated for the state this week. It's important to remember that they don't all arrive today. They are allocated to us this week, and they will arrive throughout the week, which influences the administration schedule. New to our website today will be a map that shows where healthcare personnel who are not part of a hospital or health system can get vaccinated. And there is contact information for each location that you will need to schedule an appointment. There are approximately 1 million healthcare personnel, skilled nursing and long-term care residents and staff that are in phase 1, and our vaccine providers are working to get to them as quickly as possible, and we are making consistent progress. We know that there is significant interest among all Pennsylvanians about when they will be vaccinated. We are working to ensure that everyone who wants access to a COVID-19 vaccine will be able to get it. And we released our revised vaccine plan on Friday, and that is available on our website. I know it is really challenging to have patience, but we must show patience, as the amount of vaccine available to Pennsylvanians is still extremely limited, and it will take several months before there's enough vaccine available for everyone. What people can do right now to be prepared for when vaccine is available is please contact your healthcare provider, make sure you're a candidate for the vaccine, And we must continue our mitigation efforts. Please wear a mask, wash your hands, social distance, avoid large and small gatherings. We still must stand united to stop the spread of this virus. Please download the COVID Alert mobile app so that you can get a notification if you have come in contact with someone who is positive. We cannot let our guard down. We must continue to show our personal and collective responsibility to each other to prevent the spread of this virus. Thank you, and I'm very pleased to answer questions.
Thank you, Dr. Levine. First up for questions, we have Taylor Tashoff from from ABC 27. Go ahead, Taylor.
Hi, thanks for holding this press conference today. So first off, I have two questions, if possible. When 75 and older can get the vaccine, where exactly will they be able to get it? Will it be they have to reach out to their doctors, a pharmacy, or will it be a large vaccination site?
So we're working on really expanding in many different ways that when we activate 1B, that people will be able to get those vaccines. So right now we're focusing on the people in 1A that we talked about, but we do anticipate moving statewide into vaccinations for 1B soon, and then we'll be announcing information when that program starts.
So what should 75 and older do as of now? Because we're getting calls into our newsroom, they're asking, is this going to be something I need to contact my doctor for? Should I sit tight? Is this going to be, a vaccination site like we've been seeing with the testing sites? People just want to know, how is this process, this distribution going to go?
Sure. So I would, you certainly touch base with their doctor if they have questions about their health, if they have any questions about the vaccines. And then I would sit tight as we relay that information as we're able to roll out that program.
Thank you. Next up, we have Jim Melwart from KYW News Radio. Go ahead, Jim.
Hey, good morning. I have two questions. One about the variant, and I'll start with the administration of vaccines. You mentioned the holidays, snowstorms, et cetera, that have affected, especially the administering the vaccine. When do you think we'll have a clear picture of how it's going and what kind of pace you can actually provide, if you know what I mean?
So I think things have already geared up in Pennsylvania and throughout the nation last week, and we can see that the vaccination pace has increased, and I think that will continue to increase. And I know that the Biden administration has suggested that they might make a change in terms of the administration and the distribution, that they might not hold back vaccines for second dose. Of course, it'll be very important that the supply chain is robust and substantiated to make sure those second doses will be there when they're necessary. But if when they follow through on that, that will certainly increase the amount of vaccine we have, and we will make sure that vaccine rolls out.
And the variant, seeing a lot of headlines, concerns about the more contagious variant. Can we know now, is it behavioral or is the actual, like how can you separate the makeup of the virus making it more contagious as to just behavioral and this is the one that's spreading?
Sure. So there are scientific and epidemiological ways to do that. So in England, for example, and in the United Kingdom for the UK variant B.1.1.7, I mean, they have statistically shown that it is this variant which seems to be increasing the rate of new patients in the United Kingdom. And so we have not seen that in the United States. I mean, we have had one case reported in Pennsylvania. Many other states have reported one or a few cases. There is no evidence at this time that there is widespread community transmission of this variant in the United States, but it is really important for our health department and other state health departments to work with the CDC in terms of the genetic surveillance that will be necessary to be able to detect if that variant is increasing. So there are ways scientifically to differentiate.
Thank you. Up next, we have Jamie Bittner from Fox 43. Go ahead, Jamie.
Hello, Dr. Levine. I have two different questions for you. I've been hearing from some healthcare systems this week who are receiving doses of the COVID-19 vaccine, that a lot of times they only get a few hours notice on when those doses are coming in. They don't know how many are coming or when the next doses are coming. Can you tell me how the federal government could improve their communication with the state to make this an easier process in your mind? And my second question is, the last time that I heard you speak, you were talking a lot about federal funding and how it will play into those mass vaccination clinics. Can you speak a little bit more on how much money you may need for that and if it's going to cover all of the expenses for that?
Sure. So, I think that you're correct. This is the federal program through Operation Warp Speed. And I think that, we would like to work with them to have more advance notice, both about exactly how much vaccine that we will get from week to week, but also, exactly when they plan to distribute that. So I think both the state government as well as the hospitals themselves would like some more advanced notice about that distribution. But it is up to Operation Warp Speed to do that. We are very pleased with of course, the stimulus money for COVID-19, both for testing and contact tracing as well as vaccination. We anticipate more than $100 million for the vaccination effort, and we're working now with the CDC about how that funding can be allocated to us, and we can start to use that for our communication plan, for mass vaccine clinics, many different purposes.
Thank you. Next up, we have Andrea Finney from CBS 21. Go ahead, Andrea.
Good morning. You actually just mentioned the communication plan that I was interested in knowing more about. Whenever we receive those federal dollars, what exactly will that communication plan look like?
Sure.
My station reached out to one of the local hospitals just to kind of get their take on what kind of information their healthcare workers who are currently receiving the vaccine, what kind of information they received. And they said it's been very limited. And some people have requested that information but haven't yet received it. So I would like more information about that.
Sure, yes. We have a robust communication plan that will involve, paid and non-paid media, that will involve a lot of social media that we're going to put out about the vaccine when we get that funding. So we will have more information as we're able to obtain the funding and roll that out. In addition, I think it'll be really important for the federal government to have a national communication strategy that emphasizes the safety and the effectiveness of the vaccines. And so, what we would like to do is to dovetail our communication plan off the federal plan. And we're hoping that the Biden administration for the president-elect, as they take office, will start to roll out much more robust federal communication about the vaccines that we can collaborate with.
Is there a particular timeline that you all are working with right now?
So we have not heard anything about a timeline from the Biden transition team about the communication plan, but we're hoping to.
Okay, thank you.
Thank you. Next up, we have Crispin Havener from WJAC. Go ahead, Crispin.
Secretary Levine, in talking about the slow vaccine rollout, you have blamed mistakes with the feds and you have blamed the holidays for making it tough for people to schedule time. But given that Pennsylvania is currently 35th per capita among the states in D.C. in terms of administering vaccines, does any of the blame belong to you in the Department of Health?
I'm not really blaming anyone. I think that we are really looking to give an explanation for the pace of the rollout, and then we all need to do better and continue to roll out vaccine and get vaccines into arms. The only criticism might be some of the messaging that came out of the federal government about what I think are unrealistic expectations of 200 million by New Year's, or even 20 million by New Year's, which I think was not going to be done. So I think actually the pace has increased in Pennsylvania and throughout the nation last week very well. We want to continue that and improve upon that, and we have plans this week to roll out to even continue to improve the pace of vaccinations. And so I'm not really looking to prove anybody, but we all need to do better.
In terms of that, I know some states are starting to talk about maybe expanding and moving to the next levels of their process of who can be available to get the vaccine. Is Pennsylvania considering that in terms of expanding it beyond healthcare workers immediately?
Yes, so we are having those discussions now, and as I mentioned before, we anticipate moving statewide into vaccinations of 1B soon.
Thank you.
Thank you. Next up, we have Marcy Cipriani from WTAE. Go ahead, Marcy.
Hi, Secretary. My question is about the travel restrictions. Based on the information about the cases and a lot of vaccinations being distributed, does the state have any thoughts on adjusting those restrictions and allowing people to travel without quarantine, things like that?
No, not at this time. I mean, we're still very concerned about potential increases in the number of new cases in Pennsylvania and throughout the nation. On Friday and Saturday, for the first time in weeks, we had over 10,000 new cases. Now, it's a little bit down on Sunday. It's down today. That's often our weekend pattern, and so we'll see how this week goes. It's been just over 2 weeks that we had that we had Christmas, and then Friday it'll be 2 weeks from New Year's. So we have to see. I mean, the whole country has seen actually an increase in terms of number of new cases. We are all rolling out the vaccine as quickly as we can. It will take time to continue to do that, and so we won't see an impact yet from the vaccinations on new case levels for probably several months. So no, we're going to continue those travel restrictions and quarantines as they are.
Is there, if I may, is there something that you're looking for? Is there any criteria that you'll say, if this happens, we'll do this?
Sure. So, there are many different aspects of data that we'll be looking for. I don't have one specific metric. We're going to be looking at our incidence rate, the number of new cases per capita that we see in Pennsylvania. We'll be looking at our percent positivity rate, which is still, 14.4, so it's still high. We're going to be looking at the whole country's rates, and we'll be looking at the vaccination rate, and we'll be making some decisions. We're not there yet.
Thank you.
Thank you. Next, we have Erin McCarthy from the Philadelphia Inquirer. Go ahead, Erin.
Hi, Dr. Levine. Thanks for taking the time today. You said you were in favor of President-elect Biden's plan to release all available doses as long as that second shot was still given at the proper time.
Mm-hmm.
And you talked about the importance of the supply chain following through on that. But will that make a difference if you keep seeing issues with rollout and vaccine hesitancy and hundreds of thousands of unused vaccines just sitting in freezers? I mean, does it matter if we can get the second dose here on time if we can't quickly administer it?
Well, those second doses are put aside by the Operation Warp Speed and then come out to be administered that week. So we fully anticipate that all the people who received their first dose for Pfizer 21 days ago will get their second dose this week. And for Moderna, it'll be trying to remember if it's this week or next week, that 28 days will be there. So, I think it's a misconception that thousands of doses are just sitting there. I think that it depends upon when those doses arrive and when they're going to be given. I think you'll find, as I mentioned, that there's always somewhat of a delta between the amount, quote unquote, distributed to us and the amount given, both because of delays in reporting, which can be up to 72 hours for Walgreens and CVS, as well as when that vaccine actually comes to, for instance, a hospital and then can be thawed and used. But I feel very comfortable with our ability to get those second doses to people when they're needed.
And when people are hesitant to get the vaccine, whether it is in a nursing home setting or hospital setting, do you know what reasons they're giving, and are you working to address those specific concerns in messaging beyond news conferences that I would guess the vaccine hesitant may not be tuning into?
Sure. So that's where that communication plan that we were talking about previously will come into, which will roll out when we get the funding to do so. We know that hospitals are encouraging their employees to get the vaccine. We know that the nursing homes are encouraging not only patients but their staff to get the vaccine. We want to roll out our state communication plan. And what I've been suggesting is that it's really, really important to have a national communications plan, and we're looking forward to the Biden administration's plans for those.
Thank you. Next, we have Bill Kibler from the Altoona Mirror. Go ahead, Bill.
Thank you. Dr. Levine, you said earlier, this may be redundant a little bit with the previous question, but you said earlier in the news conference that there were 827,000 doses received or something like that, and 285,000 administered. Is that mostly a matter of delayed statistics on the number administered, or does that also reflect the difficulties that providers may be having in getting organized to provide people in the proper priority order, I guess?
Sure. I don't think that there's a problem getting organized, but I think that there are a number of explanations for that. One, as I mentioned, is that some of those doses that were received might have been received Thursday or Friday. So to count it towards last week's administrations, is always going to be a challenge. In addition, as I mentioned, there are reporting delays of up to 24 hours for the hospitals and FQHCs, et cetera, and then Walgreens and CVS has up to 72 hours to report to us the administration. So there's always going to be a reporting delay. And I think we need to do better to get vaccines into arms. So all of the above.
Good. And I had heard from somebody, I think an anonymous person in a local hospital, that some doses were being discarded because of hospital policies having to do with certain groups being vaccinated on certain days and unwillingness to move to another group quickly. Have you heard that much about that sort of thing?
So we have not heard of vaccines being discarded. We have heard that there are some state providers that have vaccinated people in 1B when they have vaccine available and they don't have someone in 1A that is readily available. That is absolutely fine for me. As I said, we anticipate moving statewide into vaccinations for people in 1B soon. And at the end of the day, I don't want to put vaccine back on the shelf. We absolutely don't want to waste any vaccine. We want to put vaccine into arms. And so if any of our providers, doesn't have someone in 1A, but they have someone in 1B, vaccinate them. And we'll be putting out a lot of guidance over that soon. But we absolutely don't want to waste anything. We want them to administer a vaccine to whoever is in front of them at that moment.
Thank you.
Thank you. Next, we have Flora Pastorero from Penn Watch. Go ahead, Flora.
Hi, good morning, Secretary. In the very beginning of this news conference, you mentioned there's going to be a map and contact information for healthcare providers who are not affiliated with a hospital to be able to get the vaccine. Can you talk more about the map, the contact information, and where people can find this information on the website?
Sure. So this map will be on our Department of Health website in the COVID-19 section. And it's exactly for what you said, is that for healthcare personnel that are not part of a hospital or health system, but they are still part of 1A. And so we want them to get vaccinated. And so we have actually ordered hospitals to keep at least 10% for that mission. But then there are also FQHCs as well as county and municipal health departments that are working on that mission as well. And all that information as well as contact information will be on that map today.
Do you know when that will be on the map? Is it available now? Will it be later today?
I believe it's available now, but I know they were putting up this morning, so I don't want to promise at 11:30 that it's up, but it'll be up soon if it's not up now. It'll be today.
Thank you. Next up, we have Scott Beveridge from the Observer Reporter. Go ahead, Scott.
Good morning. We have a lot of people in the rural part of southwestern Pennsylvania who still don't believe that this virus is real. And is there any indication that you're starting to get through to these deniers?
Well, I think that we're doing the very best we can, both ourselves. I know that Commissioner Bogan for the Allegheny Health Department had press conferences. I think that the evidence is remarkably clear about COVID-19, about the dangers posed by this virus, and its spread. So, I think that it might be hard to convince everybody, but I think the science is really clear. We'll do everything we can to make sure that people understand the public health implications of this global pandemic.
Thank you.
Sorry. Up next, we have Barbara Barr from WGAL. Hang on one second, Barbara. Sorry, I don't have you. There you go. You can unmute.
Thank you. Dr. Levine, I'm wondering, everyone's looking forward to try to move into 1B, but you've said earlier there are still hundreds of thousands of healthcare workers that need to get vaccinated, and also only, I think you mentioned right now, data showing 48,000 in nursing and long-term care facilities. Are you prepared to move to the next level, next phase before all of those people are vaccinated, or a larger number?
Well, we are prepared before all of those people are vaccinated. So again, we're having those discussions, and those type of announcements will be soon. But today, we're emphasizing continued vaccination of those in 1A. But as I mentioned, we don't want any vaccine wasted. And so if they're going to vaccinate someone in 1B as opposed to wasting it, that's absolutely fine. We want to make sure at the end of the day that we get vaccine into arms. But right now, we're still concentrating on all those people in 1A.
And I did want to follow up regarding President-elect Biden's plan to try to release first doses of vaccine, which would be a departure from the current strategy of holding those second doses. Is there any concern that the manufacturers would be able to keep up?
Well, so, I don't have detailed information of the supply chain. The states don't have detailed information of the manufacturing capabilities for Pfizer and for Moderna, and then the transport capabilities. But, Operation Warp Speed does. And Operation Warp Speed will be under the Biden administration, very, very soon. So we are strongly in favor, and state health officials in general through ASTO are strongly in favor of the current immunization schedule. Is that, it's a 2-dose schedule, that the Pfizer vaccine is given 21 days after the first dose, that the Moderna vaccine second dose is given 28 days after. We're not in favor of changing that, and we're not in favor of changing the size of the vaccinations. So we're not in favor of some of the plans that have been implemented by the United Kingdom. In terms of the manufacturing chain and the supply chain, again, that's under Operation Warp Speed, which will be under the Biden administration. If they feel comfortable that those second doses will be there, then I'm in favor of their plan.
Thank you.
Thank you. Next, we have Sam Rulin from the York Daily Record. Go ahead, Sam.
Hi, Dr. Levine. Thank you for taking questions today. I have 2 questions, and one of them regards just why you felt it was important to include judges and their staff high on the priority list for the vaccination, because we kind of saw that recently, kind of them added or at least notified. So I was wondering about that.
Sure. So we're following the ACIP recommendations, and so we're following their guidelines of including the judiciary and the legal and the legal profession, where they included it in their recommendations. So we're just following the national plan.
Okay. And then my other question was regarding phase 2. I see that there's specification now of those who are 16 and older can get the vaccine then. And I was wondering just about children. And I know that there are still a lot of studies being done, but it seems like there's some concern, at least from those who I know do have children in schools. Teachers are going to be getting the vaccines, which is great. And, they say that symptoms aren't really as prominent around younger kids, but they could spread the virus. So is it just that there hasn't been enough testing done for children yet to know, or is there any concern when it comes to kind of having students back in person if they should be getting the vaccine or not?
So the only reason why our plan is following the federal plan is that the studies have not been completed for either vaccine in children. So Pfizer's vaccine is approved 16 and above. Moderna's vaccine is approved 18 and above. We have to follow those FDA and CDC recommendations. So there currently are no vaccines available for children under 16 years of age. We have to follow the science. Those studies, those clinical trials have to be done to prove the safety and effectiveness of the vaccines. And when they are done, then they'll be submitted to the FDA and then the CDC for their consideration and approval. And I expect, but we'll see how the science comes out, that they will be deemed safe and effective and approved, and then we will start that mission.